Here we are with Dr. Sandrine Sebon.
Hello. Hello, Bernard.
Hello.
Hello, everybody. Thanks to be there.
Voilà. So Sandrine is a cosmetical physician very involved in biology and toxicology, and she will show us how to address this patient. Thank you, Sandrine. Thank you, Jonathan.
Thank you. Okay, so we are talking about lower face. I prepared the right side of the patient before the session, and I want to present you the division of the face as I can see now with my experience, the importance of two kinds of division. We have 3/3 the horizontal division, as you can see, the first third of the face, upper face, the middle part of the face, that means middle face, and lower face. This horizontal division is very important, as you know, because this is how we can consider the face actually. But for my part, I consider that the vertical division is really very important and most important than the other one. So usually when we have loss of elasticity into the skin, we can see that the sagging is increasing, of course, in the proface. And if we are injecting hyaluronic acid into the malar area or into the jaw area, we will increase the sagging and have a bad result. So we have to consider the lateral area, as I did the drawing before, and to enhance the zygomatic area, this square that I drew before, and the triangle in the retromandibular area. This is very important to consider, and when we inject and we restore the loss of volume in this part of the face, we will create a facelift effect. Of course, we are only with fillers. Something very important to register, it's to avoid to inject into this heavy tears. And we have this, notch, very important to feel, and to feel the notch just behind this sagging, very important, because we will restore the lower part and the line, the harmony of this line. So I will use one cannula, of course. I will use the 25/6 centimeter cannula. Why? Because the length of the cannula is enough, and 6 centimeter is very interesting to go upper, and to be very large in our injection. I will use the fan shape technique, like we saw before, of course, and bolus technique, for example, and particularly into the notch. We will go until the chin to enhance a little bit the harmonious line of the contour. I will use the Teoxane product. I will use the Ultra Deep for restore and to project the volume, and I will use RHA, a very elastic product, to create nappage, very interesting to combine Ultra Deep and RHA. So please. I will inject the left side of the patient. So I use the Easy Guide, as Dr. Cassuto showed you before. The Easy Guide is very interesting because we are not. It's not necessary to use two movement to introduce the cannula. Very easy. I use a soft fill cannula, 25 gauge. So I didn't do the drawing in that part to show you very well how we have to inject. Usually I inject in the subcutaneous plan level, you see, very easy to slide in. And I go in the notch here into the, mandibular ligament, and I will restore the depression, the loss of volume. I am a little bit deeper than when I will inject the marionette line, because I want to be, of course, now on the bone. You see here.
Sandrine, what type of hyaluronic acid are you using?
I use, ultra deep here because I want to create a projection. It's a very high G' product and very interesting to create volume. Ça va? Okay. Okay, now I continue a little bit in this area, just to continue to harmonize this line. Okay, I continue with ultra deep with the same direction of cannula, but I want to go into the middle of the shin. As you can see here, I am in the middle of the shin. The tip of my cannula is exactly in the middle of the shin. I create a projection. And now, look, my technique for treating the marionette line is to go verticularly, very slowly, very superficially. And as I do this, I lift this fold very easily with this product. I continue. I go superficially. Look, I am vertically, and I inject slowly, very superficially. I continue in the angle. You see, I move the cannula vertically. I am perpendicular to the fold, of course, as I am injecting the nasolabial fold. You see, I continue the same movement, same gesture. And little by little, we are lifting this fold.
I would like to have Jonathan Sykes comment. Jonathan Sykes is a facial plastic surgeon, past president of the American Academy of Facial Plastic Surgery. And so what should be your strategy to restore the oval or to treat the marionette lines?
Well, I think first there's what you diagnose. And in this case, I would, like Sandrine did, diagnose that the chin was a little underprojected and the patient needed volume in this area, in the paragonial area adjacent to the chin. And she will have a lot of improvement in her face by giving a little bit of width here and a little bit of anterior posterior projection here. Then it's a matter of how you do this. I think your technique is a little interesting in that you're crossing an area that you have to be subcutaneous because the buccal sulcus comes inside here, and if you're not immediately subcutaneous, you'll put this into the mouth. When I fill this area, I like to use a more inferior approach right down onto the bone. That's my preferred method and technique. But I think there are a lot of different ways to do this. But realize if you use this as an injection port, you've got to cross an area where the buccal sulcus comes there, and it's very easy to perforate the buccal mucosa and put product into the mouth. And so I like doing it along the mandible. Let me let you go on and speak now.
Thank you. So, Sandrine, did you ever have the problem of injecting a little bit the mouth when taking this lateral approach?
Yes, of course, but it's possible to inject the mouth in the same time. So, for example, if I am in this area, I can inject the contour. Look, je sais, mais je peux pas faire autrement. Okay, you see?
Okay.
Now, I will inject the retromandibular area. It's very hot here, and the patient is a little bit... Okay, for the retromandibular area, we have to move behind my entry point. Okay, you can see I have the possibility to be very posterior, okay? And I am injecting the ultra deep on the bone in order to lift, you see, the sagging and to restore the loss of volume into the retromandibular triangle. Tiens, bon, je mets, tiens, bon. OK?
On peut avoir un plan un petit peu plus large pour la caméra.
Attends, recule un peu, ils ont un plan large. OK?
OK.
Now, as Lagdar told us just before my presentation, you know, this is very interactive between the zygomatic area and the line, the contour line. So we have to consider, as if we inject the lower part of the face, we have to consider to inject the upper part in the same time. So, for example, I am injecting the lateral contour. I don't know if you can see because I have my hand just before. I will continue with ultra deep, okay? And I am injecting the cheekbone, the tip of the cheekbone. You can see?
Okay. I would like to ask something to Jonathan. When considering the oval, many people stop on the mandibular aspect, but I think that also what I call the hidden gonion may happen in a lot of people, aging people, because maybe of the hyperaction of the masseter. How do you address this part of the mandible, which is quite deep?
If I think it's because the masseter is hypertrophic, and I see that, I might use a little toxin in the muscle itself. But my typical area down here is to go along the bone in this area, which is a little less efficient because of the big muscle over the top of it. And you mentioned earlier with the question to Dr. Cotofana, which I totally agree with your question, that in some areas, our volume is relatively inefficient, like over the chin point. In some areas, when we put it underneath of this hypertrophic muscle and the skin is thick, like the chin skin is very thick, we need more product to change it. When we put it under hypertrophic muscle in the lateral mandible, we need a little more product to change this.
And will you make some toxin injections in the muscle too, in the mentalis too?
I commonly do this as well, especially because a lot of the patients that have microgenia or retrognathia, microgenia is small chin, retrognathia is the whole mandible is back. A lot of those patients will have a hypertrophic muscle, and the muscle will dimple because their chin is small. That's why we're injecting them with filler, because their chin is small. So and both of those things combined. So I'll often do a little bit. You don't need very much toxin in the chin. You need a very small amount.
Sandrine, we are back with you. So just explain us what is your...
Yes, so I will explain now what I did. So I have injected on the bone, in the retromandibular angle, theosial deep on the bone, just in order to create a projection volume. Very interesting because combined with RHA4, it's very natural, and the elastic result that we have with RHA is very interesting to combine with this ultra deep. I have injected in the this notch the ligament, mandibular ligament area, ultra deep too, just to harmonize the contour line. And I have injected superficially with pterygial ultra deep, the fold, marionette-line fold. Okay, so as I told you,
Sandrine?
Yes?
Before leaving the injection room, because the session is quite over now, can we see the patient seated, please?
Of course. Il va falloir t'asseoir un petit peu doucement, parce que... Okay.
So on a closer view.
So you can see.
The room is applauding you.
Thank you very much. It's very, you can appreciate the combination between a middle face and lower face. And please don't forget to inject always this area in the same time that we inject the lower part of the face.
Thank you.
It's more harmonious.
So
Thank you very much.
The final comment will be from Jonathan, please.
I have one comment about aesthetics and one comment about safety. The one about aesthetics, for those of you who don't inject a lot, I think the injection right here next to the chin is one of the most powerful in making it a little wider and augmenting that part. It's often underdone because a patient does not ask for it, but it is very powerful. I would advise you to learn to do that. The second is to avoid the facial artery, as Dr. Cotofana said. So here's how I would do this. On yourself, clench your teeth, clench and unclench, and feel the front of the masseter muscle. And then take your thumb off and feel the area. That's where the facial artery always is in the antegonial notch. It's always there. And you might put an X there to avoid it when you come along the bone. You can go anterior to it, you can go posterior to it, but you don't want to inject the artery.